I've been in the Medicare business now almost 15 years, and I am shocked at the amount of people that I meet that believe that Medicare is either going to be a very low cost or a no cost program once they go on it. And folks, really nothing could be farther from the truth. Medicare has a variety of costs. In fact, some people even have to pay a surcharge to be on Medicare. So in this video, I'm going to explain those costs and the surcharges for 2024. Now, I want to begin by looking at the different parts of Medicare and the specific costs associated that we're going to be responsible for as it relates to our out-of-pocket expenses. And so when we're on any kind of an insurance plan, the first thing we have to realize is that there are going to be premiums involved. So we enroll into a plan, and that plan is going to have a premium that we have to pay to actually participate in that particular insurance plan. We also have deductibles. Deductible simply means this is something we have to pay before the plan begins to pay. And of course, there are deductibles within Medicare. We have copays. Now, copay is just simply a flat, fixed dollar amount. You can have a $5 copay, and that $5 copay is fixed for that particular service or a prescription. You can have a $50 copay, but again, a flat dollar amount. Coinsurance is actually a percentage. So what a lot of plans have is they have coinsurance, which means the plan, let's say the plan pays 80% or 90%, that means you'd be responsible for 20% or 10%. So your responsibility, your part of it then, is a percentage called coinsurance. And then also Medicare has something very unique with just one part of Medicare, which is called an excess charge. And I'll kind of teach you that here in another slide. But what I'm trying to show you is that we have these different aspects of every insurance plan that we have. And so I'm going to show you how you're impacted by these different parts of Medicare and these out-of-pocket expenses. So first off, let's talk about Medicare Part A. Part A. Now, Part A is actually called the hospital side of Medicare, or this really would refer to things that are going to be on an inpatient basis. This would be in the hospital you've been admitted, or maybe a skilled nursing facility for inpatient rehab after a stroke or maybe a hip replacement. This also includes hospice care when someone's on Medicare and in a hospice type situation. All right, so let's go through these different aspects, okay? So first off, Part A premium. Well, for most people, the Part A premium is going to be zero. And the reason for that is Medicare says that because we pay into the Medicare tax system all of our working life through FICA taxes or self-employment taxes, that they will actually give us Part A at no cost on a monthly basis for life, premium that is, as long as we have 40 quarters that we have paid into Medicare. 40 quarters, which is basically 10 years worth of work. So we pay in for at least 10 years. Right now you're paying 1.45%. Employer matches that. If you're self-employed, you pay the full 2.90%. So because we fund Medicare, they will offer us Part A when we're eligible at a zero premium for as long as we have 40 quarters. Now, sometimes people don't have their own 40 quarters, so what we try to do is get those from a spouse or an ex-spouse. So the way that works, if you don't have 40 quarters, but you're married to someone that you've been married to them for a year and they're at least 62, they don't have to be taking Social Security, just have to be eligible, then you can actually get your 40 quarters from their work record. Now, if you're not married and you're single, if you were married and the marriage lasted for at least 10 years, or longer, then you can actually get your 40 quarters from an ex-spouse, as long as that ex-spouse, again, is at least 62. Again, the marriage had to last for at least 10 years. Now, if you were married and then remarried, what happens if you remarried prior to the age of 60, still married to that spouse, you cannot go back to the ex-spouse. But if you remarried prior to the age of 60 and that marriage has ended now in death or divorce where you're single, then you can go back to the ex-spouse. So the point is 10 years or longer than you can get from an ex-spouse as well. Okay, now that's the majority of people. They're going to get 40 quarters on their own work record or a spouse or ex-spouse. But there are some people who actually have to buy Medicare A, so they have to pay a premium. They don't get it for zero. So the way that works is Medicare says anyone that has 0 to 29 quarters this year will pay $505 a month for their Medicare Part A. There's some people that have to do that. If we have anywhere between 30 to 39 quarters this year, Medicare Part A premium is going to be $278 on a monthly basis. Okay, so that's the premium for Part A. Now let's talk about the other parts or the aspects of out-of-pocket expenses. Well, we do have deductible. Medicare Part A right now has a deductible of $1,632. And this is what we pay for up to a 60-day stay in the hospital. So it doesn't matter if I'm in 1 day, 2 days, 10 or 60 days, I'm going to be responsible for a deductible of $1,632. Now, this deductible is not annual. It's tied to a benefit period. So it's tied to a hospitalization. And so what happens is when I am admitted to the hospital under Part A, I begin a benefit period. And let's say I'm discharged 7 days later. From the date of discharge, I'm still in my benefit period, still covered under the same deductible for the next 60 days, which means if I'm re-hospitalized within 60 days of being discharged and I go back to the hospital, I don't have to pay another deductible. I'm still in that benefit period. But if I'm hospitalized, discharged 7 days later, 60 days goes by, nothing happens to me, I don't have to go back to the hospital, but then I would after that, a month or two after that. Then I go back to the hospital, and now I would have to pay another a deductible. All right, so that covers us for up to a 60-day stay. Now we get into Part A copays. What this means is if I'm in the hospital continuously now, more than 60 days, once I get into that 61st day up to the 90th day, I have a copay this year of $408, $408, and that's a day. So that's month 3, $408 a day. If I'm still in the hospital after that, I'm really sick, 91 to 150 days in the hospital. Now my copay doubles to $816 a day. Okay, so that's going to be month 4 and month 5. Pretty rare when these happen, but they do happen, and they are very expensive. All right, now that's going to cover us in the hospital. Now we talked about skilled nursing, also covered under Part A. Here's the way that works. Medicare says as long as you're in the hospital for at least 72 hours or longer, and then the doctor puts you in skilled nursing, what they do is from days 1 to 20, they don't charge you anything. You have a zero copay as long as you had that 3-day hospital stay. But after 20 days, if you're still in need of rehab, 21 to 100, now you have a daily copay of $204 a day. All right, and so that's the out-of-pocket expenses on the A side of Medicare. Now, the A side has no co-insurance, and A side has no excess charges whatsoever. Now, that brings us then to the B of Medicare. Now, the B is considered what they call medical, and the way to look at this is just pretty much the outpatient side of Medicare, labs and MRIs and outpatient surgery and those kinds of things, as well as durable medical equipment and home health care after like an outpatient surgery. But the point is, this is outpatient side. So again, what do we talk about? The different aspects of out-of-pocket expenses. So first off, there's a premium. This year, 2024, that premium for most people is $174.70. I'll explain a little bit more about this here in just a minute, but this is called the base premium. Now remember, we're talking about surcharges. This is one aspect where we could have a surcharge, and I'll show you how that's going to be calculated. But I say right now, about 85% of all people don't have a surcharge, and so they're going to pay the $174.70. That's the premium for Part B. Now, Part B does have a deductible. The fortunate thing about this deductible, it's not more than once a year. It's just once a calendar year, and that deductible this year is $240. We have to pay the deductible, and then after that, once that deductible is met, then what's going to happen is we're actually going to go into co-insurance, because Medicare Part B doesn't have copays. Remember how Medicare Part A had copays, but no co-insurance. B is just the opposite. B has a deductible once a calendar year, and then we get into co-insurance. So when Medicare covers something, Medicare pays 80%, but you are responsible for 20%, and that is called co-insurance. That's actually your largest liability, because that 20% never, ever stops. And then this is where also on the B side of Medicare, we have that excess charge. And this is when a doctor adds 15% to the bill. Now, this does not happen often. In fact, I would say less than 5% of the doctors are even going to do this today. It does happen, but again, it's very rare. But when it does, that means that doctor can still bill Medicare and still see Medicare patients, of course, but they're going to add 15% to the bill. That's called an excess charge. All right? Okay, so those are the different out-of-pocket expenses when it comes to the B of Medicare. And again, we're going to talk about surcharges here in just a quick second, and that would be above and beyond the Part B standard premium. Now let's talk about Part C plans. Part C plans are called Advantage plans. Advantage plans. These are also called replacement plans. This is original Medicare. This is when someone has a private health insurance company that actually replaces Medicare for them. So let's talk about premiums. First off, to have a C plan, to have an Advantage plan, you have to be enrolled in A and B. Well, A is free for most people, as you saw, but they have a B premium, $174.70 a month in 2024. Again, we'll have possible surcharges here. But my point is, to be enrolled in that Advantage plan, we got to live in a certain service area, which is typically multi-county or metropolitan, maybe even a whole state. But we have to live in a plan service area. We have to be enrolled in A and B, and we have to pay, again, that Part B premium. Now, the Advantage plan itself, you'll notice a lot of plans, they say about 2 out of every 3 have zero premium. You don't have to pay anything to that Advantage company to be on their plan. You had to pay Medicare, of course, but not the plan. Now, those that charge, which would be 1/3 of all the plans, and by the way, there's 4,000 plans, Advantage plans throughout the country today, 2/3 no premium, and the other third is going to have a premium. On the average, it's going to be in the range of about $25 to probably $30 a month. So very, very low cost when it comes to premiums. Now, when we get into Advantage plans, the majority of them do not have a deductible. Some do, but most don't, and except they could have a deductible on the medical side, and they could also have a deductible on the drug side of the Advantage plan. Now, here's where you're going to see a big difference. Remember how we said that with Medicare A, we had co-pays for extended hospital stays, extended skilled nursing stays. When it comes to Advantage plans, you have lots of co-pays. In fact, the majority of the services that you're going to need on an Advantage plan are going to have a copay. Why is that? Well, because you didn't pay a premium for them. And so we have lots and lots of copays. Go to the hospital, $350 a day. Have an MRI, $250 for the MRI. See a specialist, maybe $50. But it's a copay type of a plan. And also with some Advantage services on the Advantage plan, there could be some co-insurance, very common for chemotherapy. Plan pays 80%, you pay 20%. Very common for durable medical equipment, CPAP machines, oxygen equipment, diabetic supplies, those kinds of things. You can have a 20% co-insurance. So again, we don't pay a premium typically, but we have copays and co-insurance, and Advantage plans cannot charge excess. So we would not see that with the Advantage plans. All right, then the last part of Medicare is the D plan. Now this is for basically self-administered prescription drugs because A and B, hospital stays and outpatient situations, will cover medications. Why? Because those are professionally administered meds. But for the meds we administer ourselves, blood pressure, cholesterol meds, insulin, those kinds of things, that's going to be covered through a Part D plan. Now I want to be clear on this. When it comes to Part D plans, there's a couple ways in which we can get them. If someone decides to stay in original Medicare A and B and get a supplemental plan to fill in these gaps, then they're going to have what we call a standalone drug plan. Standalone drug plan. That's a separate drug plan based upon the pharmacy they want to go to, the medications they take, and they pick out a standalone plan. There's some on the market right now that are zero premium, 50 cents premium, and the average right now is probably in the neighborhood of about $25 or $30 for a premium for a standalone drug plan. All right? And so there's another way in which we can get meds covered, and that is they can be integrated within the C plan. All right, and we actually would call that a Medicare Advantage with prescription drug. We call that an MAPD plan. So there's an integrated Part D plan built within that Advantage plan. Now, not everyone has to have that. If they're a veteran or retired military or retired from the civil service, have FEHB, TRICARE, or VA, they don't have to have a prescription drug plan with their Medicare Advantage. They can actually get a Medicare Advantage only plan, which covers in and outpatient. But what I'm trying to teach you, when it comes to Part D plans, there's two ways in which we can have them. Standalone separate, and we would do that if I have a Medicare supplemental plan, or integrated within the Advantage plan. So when it comes to premiums, my standalone's always going to have some kind of a premium. As I said, some are very low. I think the average right now is $25 or $30. There's some even higher than that for people that are on real expensive medication. Just had a lady the other day that literally took 24 prescriptions every single day. I don't mean pills, I mean prescriptions. So tremendous amount of medications. She cannot be on a little 50-cent premium plan or even a 25 or 30. She needs something with about $100 premium for that. But again, it's rare, but again, we could have a premium. Now over here, what happens when the Advantage plan, remember the C plan, includes a prescription drug plan, then they're not usually going to charge anything for that integrated prescription drug plan. They pick it out and hopefully it'll work for you. All right, so we have premiums. Now we have deductibles. Medicare sets a deductible on the Part D plans. This year, 2024, it's $545. The majority of plans do charge that deductible. Some could reduce it. They can't be above it, but they can reduce it. And some even will go down to zero. All right, but my point is, if you have a deductible, that's going to be an out-of-pocket expense. Now, when it comes to Part D plans, here's where you get into your expenses. Almost all medications are going to have a copay, sometimes very reasonable. Now, a lot of the Tier 1 preferred generics have a zero copay, but other meds Tier 2 and up are going to have some type of a copay. You do get into coinsurance when it comes to Part D plans. This would be specialty medication. Sometimes we see even a Tier 3 or Tier 4 have a copay, a coinsurance of 50%. And so you have to be really careful about that. Some of these low dollar plans, once you get into expensive meds, you're responsible for a coinsurance. And then when you get into what's called specialty drugs, again, you could have some coinsurance that's involved. Now, the good news is this year, even if you do have coinsurance and you're on expensive meds, they say the most someone will spend in Part D plans for 2024 is about $3,400. That's it. No matter how much your meds are, that's the most you would spend. In 2025, that's going to be capped at $2,000 for the whole year. All right, so those are the expenses. And again, Part D plans do not charge excess. All right, so I just wanted to lay this out for you to make sure you're real clear as to what aspects could be involved with your out-of-pocket expenses. Hey, if you found this video helpful and if you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, now that we have an understanding of our out-of-pocket expenses, now I want to really clarify for those of you that may have to have a surcharge as part of your out-of-pocket expenses. And again, they say right now that's about 17% of the population are going to have surcharges. Now, the way this is going to work, I'm saying there's 3 parts of Medicare that have surcharges. Now, we have Part A, Part B, Part C, and Part D. And so Part A is not going to have a surcharge at all. Okay. Now, if someone doesn't enroll into Part A on time, they can have a penalty, but that's not a surcharge. All right, the majority of people get Part A 0, so there is no premium or penalty, but I want to make sure there's still no surcharges on Medicare A. So the parts that are subject to surcharges is B, C, and D. So this B of Medicare, remember what I said? Part B premium is $174.70 a month. This is what most people pay for their Medicare. That's 83% of the population, but 17% of people have to pay more. We actually call this the base premium. And this base premium is what everyone pays based upon their income, as long as their income is below certain thresholds. So the base is based upon what we call the modified adjusted gross income. And what that means, if you want to know your modified adjusted gross income, if I'm on Medicare in 2024, they're going to look back at my modified adjusted gross income in 2022. They always look back 2 years. So in 2025, they'll look at 2023. So they look back, and they're going to look back at line 11 on your tax return, which is the adjusted gross income line, plus line 2A, which is for those who have tax-exempt interests, which are some savings bonds, municipal bonds, those kinds of things could be tax exempt, and you report that on your return. Don't have to be taxes on that. That income, but you got to report it. So they take line 11 plus line 2A, and that's going to give us our modified adjusted gross income. And again, they're looking back 2 years prior. All right, and so they have income thresholds. So if I have a single filer that's at $103,000 or less, they pay that base premium. Okay, if I have a married couple that files a joint return, that's just double, now at $206. $100,000 or less, again, they just pay the base premium. But as you can see, if I'm going to be above these numbers, as a single 103, a married couple filing a joint return above 206, now I'm going to have an additional amount that's going to be added to my Part B premium. So this thing that's added to your Part B is called an IRMAA, and it stands for Income Related Monthly Adjustment Amount. So they add to the Part B. So they're going to add something to that. There's actually 5 levels of IRMAA. I'll show those to you on the next slide. So wherever your income falls in here will determine how much your surcharge, this IRMAA, is actually going to be. All right, so that's going to be the Part B. Now, when it comes to C plan, as I instructed earlier, remember what I said? To have a C plan, what do you have to do? You got to be enrolled in Medicare A and B. So again, if you're high income, you're going to have a surcharge added to your Part B. And so any enrollment in A and B, I'm going to be subject to the IRMAA, if I'm going to be above these limits. Now let's talk about the D. So C has IRMAAs and D also has IRMAA. Now the D IRMAAs are much less, but if I enrolled in a drug plan, remember I can get a drug plan 2 ways. I can get a drug plan either standalone, separate, or it can be integrated within my Advantage plan. Either way, I'm going to have that D IRMAA, and I'm going to show you a chart on these in just a minute. Again, it's going to be based upon that same number looking back at 2022 income. So anyone that has a B IRMAA is always going to also have a D IRMAA. Let's look at those specifically. All right, here's the IRMAA chart for 2024. Just to take a quick look, and hopefully you're looking at a large enough screen to be able to see these different parameters, these thresholds. As we said earlier, if I'm below as a single person, below 103, married couple below 206, I do not have an IRMAA. All I have to do is pay my Part B premium, which is $174.70 a month. All right, so if I'm below the thresholds, that's all I pay. I have a 0 IRMAA. But now you're going to notice anywhere here from 206 to 258, now I've got an IRMAA of $69.90. Single person, let's say I'm down here between 160 and 193 over here. Now I've got an IRMAA of 279. So as I said earlier, we have 5 levels of IRMAA, as low as $69.90, as high as $419. Okay, and so you can kind of see where these are. And don't forget, they're always going to look back 2 years prior. Now, if I have a B IRMAA, now we have these same income thresholds. Now they're going to add something to my drug plan, either standalone or integrated within the Advantage plan. Again, they're substantially less. And so this person that had a B IRMAA of $69.90 also has an IRMAA of $12.90. So what is that? That's going to be $82.80. So they're paying an extra about $83 a month for their Medicare. So this is basically an additional tax because of your high income. This person here paid $279, and now they're going to pay $53.80. Right? Now, they still had to pay the $174.70, so that's above and beyond. So someone here, let's call it $280 and $50, so they're a little over $330 in IRMAA because they're high income. Now, let's go back to this for just a second. Let's say I'm on a Part D plan that just costs 50 cents a month. Remember, I told you they average about $25, $30 a month. Some higher, some lower, but let's say it's 50 cents. As long as I'm below these income thresholds of 103 and 206, I don't have an IRMAA. I just simply have to pay whatever my Part D plan charges me to be on the plan. But if I'm at this income level, same 50-cent plan will cost me $53.80 extra. All right? And so, again, you have to find exactly where you fall in these thresholds, look back 2 years, and these numbers are recalculated every year. And frankly, we usually see these numbers go up a little bit as well. It's actually tied to the Consumer Price Index U, which is for urban wage earners. And so we can expect those also to go up. All right? So for those of you that are considered to be high income, you are going to have an IRMAA on the B and on the D, and if you take a C plan, Advantage plan, you're also going to have to pay the IRMAA because you have to have B to have the C plan, and more than likely you're going to have a drug plan as well. Hey, if you're finding this video to be helpful and you would like to learn more about Medicare, you'll notice up here in the right-hand corner there's an I, and if you'll click on that I, it's going to take you to a 20-minute workshop. I see people make mistakes all the time, and we don't want that to happen to you, and that's why we're giving you free access to this workshop. So go ahead, click the link, and learn more about Medicare. Now, I'm going to conclude teaching you about something that may be an option for you. I know some of you that are just hearing for the first time about IRMAAs. It may be disappointing. I always tell people having IRMAA really is a first world problem. It is a good problem to have. I know none of us like to have to pay any more taxes than we have to, but the point is it's still a good problem to have. However, there are times when people they retire, something happens in their life. We call these life-changing events where their income's actually going to go down because of one of these 8 life-changing events. And so, like as we talked about earlier, remember we said that if we're on Medicare in 2024, they're looking back at 2022. But what happens if you retired in 2023 or retired in 2024? Well, now we have the opportunity to do what we call appealing the IRMAAs. And again, this means that your income has changed because of a life-changing event. Now, I want to clarify a couple things. First off, that the life-changing events, there's only 8 of them. You cannot invent your own list. It is these 8 and only these 8. So let me explain. So the first one is marriage. This means that someone was assessed an IRMAA in 2022 based upon income, and this means they were single and they were above the threshold. Now they have married, but as a married couple, they're going to be below the threshold. And so again, they can appeal the IRMAA as a married couple. And so they would have to have a marriage license to prove that they're eligible for that. A divorce makes sense. I have 2 incomes possibly when there's a divorce and now only 1 income. And so we'd have to prove with a divorce decree and ask them to no longer look back at 2022. And you could ask them, like in all of these, you can ask them look at 2023 or 2024. All right. Death of spouse, 2 people working, 1 has passed away. And so now that usually has affected the income. And so you have to provide a death certificate to prove that one. Work stoppage, this would be someone that's retired, made the decision no longer retire. Maybe had real high income in 2022 and still going to make good money in retirement, but not as much. And so we would actually list the retirement date, work stoppage. And by the way, on this one, you don't have to have any proof of it. You may have proof of that, but you don't have to. You just simply sign an affidavit saying I'm supplying you with accurate information. So you're signing that under penalty of perjury. Work reduction is just simply semi-retired. You may have cut back from 40 hours to 30 or whatever, but your income has been affected because of the work reduction. Now I want to clarify real quickly, loss of income producing property doesn't mean you own something, sold it, and took a loss. It means that that property is no longer producing any income for you because it's gone. It burned up in a fire, or it was slid down a mudslide. So we have to have proof of insurance that happened. But again, it's no longer giving you the income that you had in 2022, and so that would be an appealable offense. Loss of pension, the pension that you were receiving, maybe it went bankrupt. You're no longer getting that money any longer, so that certainly has affected your income. Same thing with employer settlement payment. And so the point of all this is we have to have 1 of 8 life-changing events. Let's just say we have work stoppage. We put the date in here. And so I put down here, I retired, 03/01/2024. Okay. And by the way, this can't be something in the future. This had to be something in the past. So because you may change your mind. So you're not going to win an appeal unless this life-changing event has actually happened and you attest to it or actually prove it. So when I have this life-changing event, they're looking back naturally at 2022. So what I can do, I can ask them to look at 2023, or I can even project for what I'm going to make in 2024. Just be as accurate as possible. They'll go back and look at it later. So as long as you're accurate, I guarantee you can win the appeal. And so what we're going to do is we're going to put in the tax year here that we want them to look at. Again, it could be 2023, it could be 2024. You can project that. That adjusted gross income, remember what that is? That's at line 11 on your 1040. Line 2A is your tax-exempt interest. So that's going to give us what? Our modified adjusted gross income. And then you list how you file. And then you go to page 3 of the form and you'll sign your name, put your address in there, and you're going to submit that to the local Social Security office. And folks, I've never seen an appeal be denied as long as you're being accurate and it's one of these life-changing events and it's been within the last 2 years. And again, remember, you can use this life-changing event 2 different appeals, 2 years. And so I've just never seen anyone lose those. So as long as you have these boxes checked, the appropriate date, the proper numbers as well. You turn that in, and they will either drop the IRMAA or reduce the IRMAA. Sometimes we'll have people that still have an IRMAA, but it's not as a high level, and it's well worth your time to appeal it, to either bring the IRMAA down some or to eliminate it altogether. And again, if you work with our company, we'd be delighted to guide you through this entire process.